My name is Amanda Burkardt, and I'm CEO of Phiogen. And our mission is to solve and develop solutions for drug-resistant and recurrent bacterial infections. Every 11 seconds, an American is diagnosed with a drug-resistant infection, and it is our job to find a solution to this unmet medical need. We have developed the first immunizing therapeutic that treats and prevents your infection so it doesn't come back. This is a huge problem not only in the United States. You may be familiar with superbugs, and we try to create super drugs to combat the superbugs, not only for the US, but products globally. I applied for the Springboard Accelerator program because I wanted to grow my network and find mentorship amongst other women leaders who have trailblazed before me, specifically as it relates to healthcare. Healthcare is an extremely complex environment, and if you don't have friends in high places that have been there before and can learn from their lessons, it can be really hard doing it as an entrepreneur for your first time trying to navigate. And so I joined Springboard really looking for that advisor and mentorship. What I found is I actually ended up learning more from the other women in my cohort who are CEOs at different stages. And we actually ended up helping each other in ways that I didn't know were possible. And I'm excited to share that our relationships that we've built along this program are going to be something that outlives our time together as a cohort. So I got more than I expected from Springboard, not just an advisor and mentorship, but also with new colleagues, like-minded CEOs, and now I'm happy to call them my friends. I have many experiences that I could look to as what were some of the most compelling points of the Springboard Accelerator, but I'll just highlight one in particular. When I came to the program, I was looking for questions to be answered as it related to fundraising, but also questions that I was getting from investors, like how would your product be priced? What does reimbursement look like? And so through this program, I was able to build my advisor and my advisory team to really help me answer those questions and get me networked into the right places where I would have never before been able to access, especially since a lot of my advisors had large pharma background. They were really able to plug me in and advocate on my behalf. And so that allowed me to kind of leverage their years of experience in large pharma to get into doors and have meetings with people who probably wouldn't have meetings with me before. So if I could share some key takeaways as you're building your advisory team, try to really research the advisors that are available and really have those meetings with the Springboard team, whether it's Miranda or Amani or whoever the CEO is, and really try to figure out who the advisors are part of the network and build your advisory team to fill the gaps that you need. And I feel like that's what I tried to do coming in, and where I got the most benefit was building my advisors to fit my needs, but also identifying advisors who shared my passion and most importantly had the time to commit. And it really evolved and resulted in good outcomes for me.